If you're over 60 and trying to stay healthy, you're probably doing what your doctor tells you, getting all the routine checkups, even if you feel fine. But here's the painful truth. Some of the most common medical tests for seniors might actually be putting you at risk. Does this sound familiar? You go in for a routine test, feel great, and walk out with a follow-up appointment, more blood work, or even a biopsy, only to later find out it was all unnecessary. It's a frustrating cycle that steals your time, your peace of mind, and sometimes even your health. According to a 2023 report in BMJ Evidence-Based Medicine, many routine screenings in older adults lead to overdiagnosis, stress, and harmful follow-up procedures without increasing life expectancy. That means you could be going through tests that do nothing to help you live longer or better. That's why we need to talk about Arnold Schwarzenegger. At 76, he's not only still working out, he's making bold, evidence-based decisions about his health. Arnold skips 5 health checkups that most seniors are told are essential. And he's not doing this recklessly. He's doing it because these tests often backfire. In today's video, we're revealing the 5 checkups Arnold avoids, the surprising risks behind each one, and what smarter health screening really looks like after 60. If you want to stay healthy without falling into the trap of medical overkill, you're in the right place. Before we dive in, tell us in the comments below, what's the one medical test or screening you've had recently that made you second-guess its value? We'd love to hear your story. And don't forget to like this video and subscribe to the Wellness Vault for weekly health insights grounded in science and designed for people just like you. Number 5 is the prostate-specific antigen test, commonly known as the PSA test. This blood test is designed to detect early signs of prostate cancer, and it's been a go-to screening tool for decades. But while it sounds like a responsible move, especially for men over 60, the truth is far more complicated. Arnold Schwarzenegger, who's still lifting weights and biking into his 70s, has chosen to skip routine PSA testing after age 70, and a growing number of medical experts support that decision. The reason is simple but rarely talked about. As men age, their PSA levels naturally rise, even without cancer. This means a slightly elevated PSA doesn't always signal something dangerous, yet it often triggers an alarm, leading to a cascade of more tests, including prostate biopsies. And that's where the real trouble begins. These follow-up procedures can carry risks like bleeding, infection, and in some cases, long-term urinary or sexual complications. What's more concerning is that many of the cancers caught by PSA testing in older adults are slow-growing. They're the kind that would never actually harm you in your lifetime. A 2018 study in the New England Journal of Medicine showed no reduction in mortality among men over 70 who underwent regular PSA testing. What it did show was a sharp increase in unnecessary procedures that didn't help patients live longer or better. Arnold prefers a smarter approach, one grounded in common sense and current science. If he has no symptoms, he skips the test. But if there are red flags like difficulty urinating, frequent nighttime trips to the bathroom, or unexplained pelvic pain, that's when he and his doctor talk about the next step. It's not about avoiding care. It's about applying care when it's truly needed. This strategy is called shared decision-making, and it's what modern medicine is increasingly moving toward. Rather than defaulting to a yearly PSA test just because of age, it's better to evaluate your risk, talk to your doctor, and decide together what makes sense for your unique situation. You might still choose to test, but the key is doing it with a clear understanding of the risks and benefits. So the next time your doctor recommends a PSA test, pause and ask a few questions. Is there a specific reason to test now? Are there symptoms to investigate? And what will we do with the result? These are the questions Arnold asks, and they're the ones that could save you from unnecessary worry and procedures down the line. Let's pause here and recap what we've covered so far. First, we talked about the PSA test. It can lead to unnecessary biopsies and long-term complications without actually helping you live longer. Arnold skips it unless he has symptoms. Then we covered whole-body scans. These sound futuristic and proactive, but often lead to scary discoveries that turn out to be nothing, followed by invasive testing that's unnecessary. Arnold only scans when something feels off. And number 3, the annual EKG. a test that might pick up minor blips and set off a chain of follow-ups that don't improve your heart health if you're not showing symptoms. Arnold uses it when his body tells him something is wrong, not because the calendar says it's time. These tests aren't bad tools, they're just often used the wrong way. That's the message here. It's not about skipping care, it's about smarter, evidence-based care that works for you. Arnold isn't avoiding medicine, he's avoiding over-medicine. And that's a message that could save your time, your money, and your peace of mind. If this video is helping you rethink how you approach your health, hit that like button and drop a comment below with which of these tests you've had, and whether it helped or caused more confusion. Subscribe to the Wellness Vault for weekly videos that challenge the status quo and put your health back in your hands. Now let's move into the final 2 checkups on Arnold's list. These might surprise you even more because one of them is considered a gold standard in senior health, but not the way Arnold sees it. Number 4 is the whole body scan, which includes full body CTs or MRIs, marketed as early detection tools for disease. These scans are often sold to older adults as a way to catch cancer or hidden illness before symptoms appear. On the surface, it sounds like a smart idea, but when you dig deeper, the science tells a different story. Arnold Schwarzenegger doesn't get full body scans unless there is a clear reason, and for good reason. The problem with whole body scans isn't just the cost or inconvenience, it's what they find. These scans often reveal small, harmless anomalies called incidentalomas. These are non-threatening cysts, nodules, or growths that show up on a scan but would never actually cause a problem. Once one is found, doctors often feel pressured to investigate further, and that's when the real trouble starts. You may end up with follow-up scans, biopsies, or even surgery for something that would never have impacted your health. A 2019 review in JAMA Internal Medicine found that more than 30% of people who received full-body scans ended up getting additional tests for incidental findings. In many cases, those follow-ups led to complications, stress, and months of uncertainty. None of it improved the person's quality of life or added years to it. It just created fear over something that was never a threat in the first place. Another serious concern is radiation exposure. CT scans in particular involve significant doses of radiation. When you start doing them every year as a preventive measure, that exposure adds up. The cumulative effect may even increase your risk of developing cancer down the line, which is the exact opposite of what you were trying to prevent. Arnold's approach is simple and smart. He doesn't chase problems that don't exist. He only agrees to scans that are targeted, meaning they focus on a specific issue or symptom. If he has unexplained pain, vision changes, or breathing issues, his doctor might order an imaging scan for that area. But he never signs up for full body imaging just because it's available. The takeaway is this: just because a test exists doesn't mean it's the right choice. More information is not always better, especially when it leads to unnecessary procedures and anxiety. Instead, follow Arnold's lead. Stay alert to symptoms. Stay connected with a doctor you trust, and only scan when there's something worth scanning. That's how you protect your health and your peace of mind. Number 3 is EKGs, also known as the electrocardiogram. It's a simple test that measures the electrical signals in your heart. Doctors often recommend it once a year for people over 60 to check for hidden heart problems. But Arnold doesn't get it yearly, and if you're healthy and symptom-free, you might not need to either. The idea behind routine EKGs sounds good in theory. Catching heart issues early could mean preventing a serious event like a heart attack. But here's the problem. In people who don't have any symptoms, EKGs frequently show minor irregularities that are completely harmless. These blips can lead doctors to order more tests like stress tests, echocardiograms, or even cardiac catheterization, none of which may have been necessary in the first place. A large 2021 study published in the Journal of the American Medical Association looked at tens of thousands of older adults and found no improvement in health outcomes for those who had routine EKGs compared to those who only had one when they showed symptoms. What did increase? The number of people getting follow-up tests, procedures, and unnecessary worry. That's a high price for a test that may not actually help. Arnold's approach is grounded in both experience and evidence. He had a baseline EKG in his 60s to establish his heart's normal rhythm, But unless he feels something unusual, like chest tightness, skipped beats, or lightheadedness, he skips the annual repeat. He trusts his body and listens to it rather than checking a box just because of his age. This kind of selective testing helps avoid a cascade of anxiety-driven decisions. Too many people walk into a routine checkup feeling fine and walk out thinking they're sick, all because of one vague test result. The EKG isn't bad in itself. It just needs to be used at the right time, not every time. So if your doctor automatically orders an EKG every year and you haven't had any symptoms, it might be worth a conversation. Ask why. Ask what the result will change, and consider whether the test will really help or if it could start a chain of tests you never needed. That's the kind of clarity and self-advocacy that keeps you in control. Just like Arnold. Number 2 is the DEXA scan. This stands for Dual Energy X-ray Absorptiometry. It's the most common test used to measure bone density and assess your risk for osteoporosis. While it can be a valuable tool, it's often misused, especially when it's done too frequently. Arnold Schwarzenegger doesn't get this scan every year, and most healthy adults over 60 probably shouldn't either. The scan itself isn't harmful in a direct sense. It's quick, painless, and uses a low dose of radiation. But the issue comes down to how it's applied. Many seniors are told to repeat the scan yearly, even when there's no change in risk or no symptoms. That kind of routine testing can lead to overdiagnosis and treatment based more on numbers than on real health outcomes. A 2024 study published in The Lancet Rheumatology tracked older adults who had DEXA scans every year and compared them with those who had the scan every 2 to 5 years. The results showed no significant difference in fracture rates or bone health outcomes. But the group with more frequent scans experienced more medication prescriptions, more anxiety about bone loss, and more confusion over what the numbers really meant. Arnold has taken a different path. He focuses first on lifestyle. His routine includes strength training, daily movement, adequate protein intake, vitamin D, and calcium-rich foods. He knows that the best way to prevent bone loss is through consistent weight-bearing activity, not just through a machine that gives you a score. When Arnold does get a DEXA scan, it's because something has changed. Maybe there's been a fall, a shift in medication, or a concern raised during a physical. In those moments, the scan provides useful data. But if nothing has changed and there's no specific concern, he lets it wait. That way, he avoids unnecessary worry and stays focused on real prevention. If you're over 60 and your doctor recommends an annual DEXA scan, ask why. If your previous scan showed healthy bone density and you haven't had any major changes, spacing it out every few years may be just as safe and a lot less stressful. Like Arnold, you don't need to chase numbers. You need to build strength and stability where it counts. Number 1 is the full blood panel. This is the catch-all test that includes 20 or more markers covering your liver, kidneys, thyroid, cholesterol, inflammation, hormones, and even vitamin levels. It's often ordered once a year at your annual physical, even if you're feeling perfectly fine. On paper, it sounds smart. But for healthy seniors with no symptoms, it can lead to unnecessary stress, confusion, and treatment you didn't need in the first place. Here's why. As we age, our bodies naturally shift in ways that aren't always reflected in standard normal lab ranges. What looks abnormal on paper might actually be completely harmless for someone in their 60s or 70s. But once a test result comes back outside the lines, even slightly, it usually sets off a chain reaction. More blood work, scans, referrals, and in some cases, medication. All of that can be triggered by a single number that didn't really matter. A 2023 study published in BMJ Evidence-Based Medicine found that routine full blood panels in seniors led to more false positives and unnecessary follow-up procedures without reducing hospitalizations or increasing lifespan. In short, these tests made people worry more, not live better. And once you start chasing minor abnormalities, it's hard to stop. Every test leads to another, and the cycle continues. Arnold Schwarzenegger avoids that cycle. He doesn't do blanket testing just because it's routine. Instead, he uses what doctors now call precision health. That means testing only what's necessary based on current symptoms, medication use, or known risk factors. He checks cholesterol every 5 years. He screens for diabetes every 3. And if he's feeling fine, He doesn't go digging for problems that might not even exist. This isn't about ignoring warning signs. It's about not inviting problems where there are none. The goal isn't to collect as much data as possible. The goal is to protect your health in a way that's intelligent, efficient, and focused on quality of life. That's why Arnold trusts his habits, exercise, diet, sleep, more than a printout full of numbers. So the next time your doctor suggests running a full blood panel just because it's been a year, ask yourself this: am I being tested for something specific, or are we just casting a net and hoping not to find anything scary? Following Arnold's lead means taking control of your health choices and using modern medicine the way it was meant to be used, as a tool, not a trap. Let's wrap things up with a full overview of what we've covered today. We started with the PSA test. While it's marketed as essential, it often leads to biopsies and treatments that do more harm than good in older men. Arnold skips it unless there's a real need. Then we moved into whole body scans, CTs and MRIs that promise peace of mind, but often deliver false alarms and radiation exposure. Arnold's rule is simple: scan only when something's wrong. Then we talked about annual EKGs. These are often scheduled automatically, but for people without symptoms, they rarely improve heart health and often lead to unnecessary follow-ups. Arnold only repeats them if his body signals something off. From there, we looked at DEXA scans. Important? Yes, but not every year. Arnold uses them to guide decisions, not to chase numbers. And finally, the full blood panel. Comprehensive on paper, but a magnet for false positives and unneeded worry. Arnold tests only what matters when it matters. These 5 checkups aren't bad, but when used blindly, they can do more harm than good. Arnold's approach is about intentional care, not habitual testing. He listens to his body, works with his doctors, and uses modern medicine as a tool, not a trap. Now it's your turn. Drop a comment below and let us know which of these tests you've done recently and how it made you feel. Was it helpful, or did it leave you more confused? We want to hear your story. And if you found this video eye-opening, hit that like button to support the channel. Subscribe to the Wellness Vault for weekly health videos designed to help you think differently, live longer, and age powerfully. Thanks for watching. Until next time, stay strong, stay sharp, and stay independent.